Welcome back to the Crooked Spine Show. This is episode 4 of Derek and Dr. Tony talking about shoulder rehab. Derek has worked extensively with professional pitchers, understanding he has a very extensive assessment of the shoulder to help pitchers, may help the everyday weekend warrior, may help the everyday weekend or weekday professional get their shoulder better overall. His assessment includes a full body assessment because we don't know where it's coming from. And his big concern is if I fix the shoulder problem only, can it come back? And where can it come back from? So we walk through the assessment of from the feet all the way up to the neck and shoulders, from the back, from the front, from the side view too. Also how to stretch the shoulder using a band and foam roller. Also why posture is important too. So go to the talk and go to the highlights to understand what's going to work for you to get your shoulder better, your overall body better so your shoulder does not hurt if it is not a problem then. And also go to the highlights so you actually see what's going on with your body so you understand how to get your body healthy and keep it that way. Right, enjoy the talk. We'll wrap it up afterwards. We are live. Cool. All right, this is Mr. Derek Ward, Life Performance Enhancement. This is our episode number 4, I think. That's what I'm looking for. And what we've done before is walk you through in my office and even at home too, because of COVID stuff going on, more Zoom talks of how to assess the shoulder, the overall body, getting out of quarantine, what you have to start doing. Today we're going to talk about how do we actually do the assessment on the shoulder, how does it work, how do we get the overall body to function better so that shoulder can work better, either from an injury, or if you want to get stronger if you're an athlete, or just want to be able to have a normal lifestyle with the shoulder problems of the past. So Derek, take it over, let's just get started.
Sure. So I'm Derek Wohlers. I know I've been on here before, Dr. Tony. It's great to be back on here again. You know, I love doing the show with you guys. I love teaching and just giving away knowledge. It's one of my favorite things about my job. So like Doc said, I own Life Performance Enhancement. It's a private personal training studio. I'm a certified personal trainer, certified master personal trainer, strength conditioning specialist, certified sports medicine specialist with a bachelor's degree from Azusa Pacific in physical education. I've been a professional in the industry for 15 years, and I'm also a former university strength and conditioning coach for 5 years at Azusa Pacific University, where I oversaw strength conditioning for the baseball and the tennis programs.
Perfect.
I've coached around the country for different organizations, served as a consultant for different organizations, primarily on sports-specific training, and my niche expertise is the shoulder, and that's what we're here to talk about today. So,
what coincidence.
Yeah. So what I wanted to do with Doc today was, give away some good information to you guys that hopefully you can use in your own life that would benefit you. If you're a professional watching this, hopefully it benefits you as it has benefited me in my professional career as well. What I wanted to do was kind of use Doc today as the guinea pig and just show you guys a little bit about a portion of the shoulder assessment that I do. I do a very exhaustive assessment of the shoulder. I have a baseball background. I also was the pitching coach at Azusa Pacific University for 2 seasons while in conjunction while doing the year-round strength conditioning. I was a former pitcher myself through college, so I have great practical experience, education, and coaching experience on the field with that specific athlete as well. So I deal with a lot of baseball guys, okay? They'll come in here, pitchers primarily who are trying to alleviate pain, or young pitchers whose parents are being proactive and doing a great job of preparing the young arm for the future abuse that it's going to take from ages, like 13 through 18, when you really start to throw with larger amounts of volume. Guys will also come in here and see me when they're stuck in that 82 to 84 mile per hour range and they're looking to improve velocity. There's different things that you need to do to the entire body, but also specifically with the shoulder to help enhance a pitcher's ability to throw the ball faster. So
even softball players, I'm assuming too, anyone that throws a ball will be helpful with knowing how to throw the shoulder properly. If you have an injury, how not to compensate, how your overall body should work, normal mechanics. So as like we talked about before, as we grow into those better mechanics. And overall bodies keeps that as we go from 13 to 18 to 20, 24.
Sure, yeah, there's a differentiation in the shoulder movement with the softball pitcher as opposed to a baseball pitcher. Obviously, the softball's coming under and the baseball's coming older, but the softball,
still in general.
Yeah, but the softball, the infield, outfield catcher, they're all throwing with an overhand movement as well. So they will, they'll come in here from time as well, and those type of injuries are that type of rehabilitation is conducive for both sports.
Perfect.
Yeah, for sure. Yeah. So what I want to do first with you guys is talk a little bit about how I kind of initially start off my assessment. Obviously, everybody's got to sign a waiver. That's the first thing, and then after that, I like to just kind of get a look at the person in a standing position. So we're going to have Doc stand it up here.
Take the camera around just a little bit, just to make sure we're on track with everything. Right there. Let's see how that looks.
For sure. So we'll get Doc here. Yep. Now, what I do with people, everybody, is I first like to try to get as deep inside of the body as I can, and that would be our skeleton. Okay. So the first thing that I believe that you should do in a shoulder assessment is you want to take a look at the skeleton and look at the person's resting posture. I like to do that from 3 vantage points. I like to look at the person from the front. Here we got Doc from the front. I like to then look at him from the posterior on the rear side of the body. And then I also like to look at them from the side here. Well, I would have Doc stand here, and I'm going to get a look at the side. Go ahead and turn back in front. So what I want to do is just kind of explain to you guys real generally. Now, if you're a professional watching this, obviously I go in greater detail in my mind and on my charts with when I am assessing posture and as well as everything else that I'm going to talk about today. But this is just for general purposes, kind of a surface explanation of what one should look for and what I do generally.
Okay? In my disclosure, too, I actually tore my shoulder back in 2000. So for me, it's a benefit by getting this done, so I understand how my body's going to work and how it's either compensated or hopefully maintained that period of time.
Sure. Awesome. So again, starting out with the front of the body, what I believe that you should do is also look at the body, the way that it transfers energy. So that is from the ground up. So I will start with the foot, and they will have their shoes off. Doc's got his on, but it's all good.
I have nice shoes.
Look at those things. So I will look at their feet, okay? And feet are kind of funky, to be honest with you, man. I mean, there's a lot. I've dealt with clients in the past when they've had foot issues, and I've had to go deep inside the foot and actually learn, how it works, specifically how the muscles function through active and passive propulsion. It's called during our gait cycles and whatnot. But today, what I'll talk about is very generally, you want to look at the position of the ankle at rest.
But Derek, why am I looking at my feet if the problem's in my shoulder?
Okay, so the way the body kinetically transfers energy is from the ground up. Now, anytime you're going to assess a joint in the body, you want to see the pathway that the energy is flowing through the body to get to the joint first. And because everything works harmoniously or synergistically or however you want to state that, okay? So it's very important that you are as thorough as possible in the evaluation of the body, because you want to do as much as you can. As the strength conditioning and sports medicine guy, I try to do as much as I can for them in their entire body to benefit not just the area of injury or desired performance enhancement, but also in their daily life as well. Okay?
That'd be nice.
Yes, so you look at the feet, you want to look at the position of the ankle, whether the ankle kind of sits neutral, where the person maybe has what you would call maybe like a medium arch, or if it sits slightly outward, where they're kind of a high arch person, or maybe they have a low arch and their ankle is kind of rotated internally like this, which is very common in the population. It's known as pronation. Supination is when the ankle is kind of more in this outward tilt like this. If you're more of an endurance-based type person where you excel in endurance-based activities, typically you're going to have more of a medium to low arch or possibly pronated arch. If you're more of an explosive person, say you sprinted growing up, you were a fast kid, something like that, your arch is typically going to be a little bit higher. And we can go into great detail as to how that affects the muscle recruitment and all that kind of stuff, but those are just some general things for you guys to do. From there, you further work your way up the body. I like to look at the knee, so if I'm going to get behind here and, we would tilt the camera down a little bit. Go ahead, Doc.
I'm the videographer today, too.
There we go.
Say hi to Joel. How are you doing, bud? And Miss Lucy. Hey, guys.
Cool. So we can see Doc's knees. Now it's tough with the pants, right? But Doc, maybe if you could pull the pants tight a little bit. So what I like to do, now all clients of mine go through an orthopedic knee evaluation as well. But when you're assessing skeletal posture, it's really good I like to look at the knee and kind of see if the bone, if the femur is maybe slightly internally rotated, if we have any type of valgus going on, and that kind of thing. Yeah, that kind of stuff going on. That kind of gives you an idea, a little bit more of kind of his of how his body's going to transfer energy up into the quads, into the hip, glute area, and then eventually into the lower back. Go ahead and bring that up. Go.
Let's go right here. There we go. Let's get to the back.
So now we get into the hip area, and this is all in the front. Now what I like to look for in the hip area first is I try to see the position of the pelvis. Okay? So I will, this is done with the shirt off with the males. And with the females, if they're comfortable, I prefer done in a sports bra or somewhat of maybe a tighter fitting shirt or whatever. So what I like to look for is the position of the pelvis. Now, a lot of people don't know this, but the majority of our population has one leg that is longer than the other. And so it's really important for me, when developing a personalized program for somebody, to assess the height of each point of the pelvic area like that. Because that could be coming from tension and muscle, that could be lifting the pelvis slightly, Doc. You know, Doc knows the skeleton far better than myself, but it could be lifting the height of the pelvis in some type of tilt like this on either side of the body, or it could be an actual differentiation in leg length. Okay.
Well, would you see that as someone's posture, see a rotation component, or would you
Okay, so what I do it old school. You know, I mean, now if you're a chiro like Doc and you got an X-ray facility, you got an X-ray thing in your facility, you X-ray the pelvis. You take a ruler and you go on one top of the crest. Hey, honey,
what I normally do too is I'll use my X-ray glasses even to see it too.
So you just X-ray the pelvis. You get a ruler, you draw a line from one tip of the crest to the other, and then whatever, if there is a differentiation, you measure it and you stick a lift in the short shoe. There you go. That's all you really do.
That depends, because you said before too, everyone is off a little bit. So,
yeah.
So that's a normal variant. But if you're off more than 5 millimeters,
that's right.
Then you got to worry about, okay, do you need a little bit of lift? You need just something in there from 10 millimeters to talk about maybe building up a shoe. But most people are within that 5 millimeter difference, 0 to 5 millimeters. So at that point, even though it won't be an anatomical deviant for your body, but it will cause an effect, especially for an athlete or a runner or someone that affects, because if you have a leg longer than the other, it makes that hip or that area kind of wear itself down faster, correct?
It absolutely, Doc. It makes it work harder. Now, there is a professional opinion in that differential length in between chiropractors, therapists, strength conditioning specialists like myself. You know, for me, any differentiation in the skeleton, I believe, should be corrected.
Especially with what you deal with too every day.
Yeah.
Any
differentiation in any type of issue with the skeleton should be corrected. If it's not, undue stress is going to be put on the body kinetically, and typically it's going to screw around with your tendons, and that's. You know, and then comes inflammation, and then comes joint range of motion and functionality limitations, and then after that occurs overuse injuries.
What I like about your assessment too, you work from the ground up, so you're seeing everything. So even though we use our shoulder, what do we do with our shoulder? We're moving with our shoulder to be an athlete or not. So our overall body is affected by everything in our body. So that balance of from your legs to your hips to your core to your upper body, that connection is huge. That's where all your weight sits, is on your pelvis and your lower back.
And I have personal experience with this. I had to go through all this as a young athlete. I had a 12 millimeter differential in my own leg heights in my youth, and I had tendonitis in the left knee. And I had a great chiropractor, Dr. Michael Fisk. He did exactly what I explained. He took the pelvic X-ray. He found that. He balanced out my pelvis. My leg actually ended up growing, I think, 4 millimeters. And to this day, I wear an 8 millimeter lift in my shoe all the time. If I didn't do that, I probably never would have got rid of the tendonitis in my knee. And in time, it would have it puts undue stress in the lumbar of the back too, especially if you play a sport of rotational nature. And because of all the pelvic movement and all the muscles that surround and are involved in the lumbopelvic area, meaning your lower back and kind of lower abdominal area that attach to your pelvis. They're very deep in there, like the third layer of muscle.
Well, it's where all your upper body weight sits, is on your pelvis, on your hips.
Yeah.
And that's 8% of your body weight, so that's when you have to make sure that's stable and balanced at the same time. So good.
Yeah, Doc is totally right. You know, it works its way up there. If you're a person that deals with chronic, my shoulder, my trap, my neck's always tight, you know, you need to come in and get evaluated, because if you have not gone this deep inside your body, maybe nobody's ever helped you to the degree that they could have.
That's the plan. That's the plan. You have to find out exactly what's going on with the whole body. not just a piece of the body.
For sure. So what I do, guys, is I eyeball it, to be straight up with you, and I've done it now, for so many years that I got a pretty good idea of being able to damn near get it on the millimeter, within 2 millimeters, I'll say.
Right. Yeah.
So I just go on the top of the pelvic area in here, and then I'm facing the client's frontal portion of their body, and then I will look at my fingers, and you just want to see if they're up there. Doc feels slightly lower here on the right, on the left side. Is that correct, Doc?
That is correct.
Okay, so Doc's a little lower there, and that's just from feeling 15 years of doing it. We all got a job, right? So, boom, got it figured out like that. Then I'd say, hey, you know what? I'd really recommend that you go get an X-ray. It shouldn't cost you more than a copay. And when one doctor's visit, and then, let's see if that chiropractor, like Doc can measure that out. If we're 3 millimeters more differentiation, then I would recommend a lift for that person.
Good.
From there, you got to work your way up the body further. So, can we tilt it up, Doc?
You want me closer to, or am I good where I am?
Good right there, yeah. Cool. Okay, so as you work your way up the body, what I like to look at now is the chest and the collarbone area of the body. I look at, for the male, I look at the nipple line. So I just try to eyeball the nipple, and you want to see if those guys are even with each other. If they're not, it will further validate what you found in the pelvic area if this one is lower with that.
Can that be structural, or could that be muscular?
It could be both. That's where I was just going to explain that. Thanks for saying that.
Sorry.
Oh, absolutely, Doc. So Doc is right on the money. That's what I was going to say next. That's why I included the collarbone when I talked about it right in here. You want to kind of look at the bone. I like to put my hands on there and just kind of, you just kind of want to see.
I have good collarbones.
You just want to kind of see if by eyeballing it again, if there is a differentiation at different parts of the clavicle in here. And, if you're able to see any type of alteration in that. That's all you're really trying to do.
I've been working on them too, by the way, in quarantine.
Doc's never afraid to flatter himself, is he?
Working on.
Then obviously you look at the acromion bone up top.
What is your acromion bone?
There's a little bone up here. It's got a hook shape on it up in here, and it's in here. The shoulder is primarily just connected with ligaments, tendons, and muscle. It's not really It's not really in an enclosed kind of skeletal type thing, right? But the acromion is kind of the one bone you got up top here. So you want to kind of look at the acromion bone on each side here and take a look. If you can see that on camera, we're obviously lower here than we are here. So it further validates that. Now, like Doc said, injury, muscular, possibility that we have an issue with the trapezius. Okay, trapezius kind of comprised of, let's say, 3 areas, okay? Yeah, we'll just stay front right now. So that tells me, like, hey, you know what? It's more than likely it's skeletal, but because of this excessive dip I'm seeing in here, which seems to be from years of experience more drastic than what I saw in the hip, I'm going to say, you know what? I need to look further into his muscle function of the upper, mid, and lower trapezius, as well as his rotator cuff's ability to stabilize the humeral head in the fossa, which is a fancy way of saying hold your upper bone in the socket.
Yep.
Okay, guys, that's all that means. So that's where I take it further. So from there, I'm going to go ahead and turn Doc around. What you do is you move to the back of the body in here, and I like to start in the lumbar area. I like to kind of get a look at muscular development. Again, you guys, this is just years of seeing people's, if you want to, Doc, go ahead. Seeing people's backs and muscles, okay, every single day. Yeah, you can see it a little bit, maybe a little higher in here. And so, I'm able to eyeball, and you can see where there's more muscular development in other. It kind of gives me an idea of their dominant side. I'll usually ask them based on what I see, hey, are you left-handed or are you right-handed? And that kind of lets me know if I'm on the right path, So from there, I'll look at that. And then I also kind of try to look at the pelvis again, just to further validate what I saw previously from looking at the anterior portion of the body. And then we'll kind of move up here into the spine and into the thoracic cavity, which is just a fancy way of saying your middle back. Okay, so I then look at spine. Is their spine curved? Do we have any minor or major forms of scoliosis or anything like that through the spine? I also will then begin to then look at lat development. And that can, okay, so the lats are kind of this outer chunk of muscle that you got right here. They attach, I believe, to the bottom portion of them is on the 11th rib, and then it works its way back up in here near the scapula. And so it can have an impact on scapular function in daily life, especially in the overhand throwing athletes. You have to be very careful with lats when you train the overhand throwing athlete, how much you develop them, the impact they're having on the quality of movement of the scapula upon the rib cage, and so on. Okay, and then from there, you move on. You look at the actual issue, the scapula, right? The shoulder blade. So go ahead and rest by your side, Doc. We'll bring this down. Now, what I look for in the scapula is its rest. You can take it off, Doc, if you want to. What you look for, guys, when you're doing the scap, is you got to look at it, okay? And you want to see where it rests in their normal posture, okay? Because this is going to determine how well the muscles move the scapula through different planes of movement, like forward, backward, kind of around or to the side, however you want to explain that, and that kind of thing. So you kind of generally look at 2 points. I'll take a little expo marker and I'll put some dots at the top and some dots at the bottom, and then I'll look right away. If I get I'll take a piece of string, put a piece of string on there, and that just kind of lets me know if there's any type of differentiation. It will further validate the possible leg length differential that we found in the pelvis, if not, and then it will also give me a greater amount of knowledge of where his brain is at in its connectivity to the muscles of the trapezius and how well they are positioning the position of the scapula at rest, which is key. It's extremely important because all movement this is the origin of his movement, is this position here. So as a specialist, I may need to improve this resting position so that what occurs thereafter is more efficient in the muscle recruitment patterns and how the shoulder is able to function in daily life or perform with an athlete. Cool? Okay.
So you basically want a better balance in the body, or test the balance, assess the balance. So if there's an off balance, and if my off balance, the shoulders are here, is my pelvis doing the opposite, so I still feel center of gravity, but even though that's not normal, it's going to mess with my kinetic energy, mess with my actual gait, my overall motion, to make things like we talked about before with the hip, maybe wear itself out to where things can cause problems, tendinitis, muscle strains, things like that.
Yeah, so, guys, Doc is so knowledgeable about the skeleton, it's unbelievable. So what he's getting at is this. The chiropractor's mind is always skeleton, central nervous system first. So he's talking about how the differentiation in his leg length is going to take his pelvis and position it differently as in your daily life. Your body's transferring energy all day long up the body. This is going to have an impact. Let's say he's internally rotated, or if he's short. Doc, you were short on the left. So this pelvic area here on Doc is a little bit lower like this, which means that his body, what Doc talked about, which he used the word balance, the brain is trying to create symmetry in the body all of the time and balance and bring harmony to yourself so you are more at peace or at rest in your muscle tension, so that your nervous system fires better, your muscles, they move and flow for you better, your quality of life is better. So Doc is low here. His brain is going to tighten up here to try to elevate the scap so that there is equality in the scapular position on both sides, so it feels like, hey, I'm in balance, right? If it's not, then we're not going to be in balance, and your body was created to attempt to always search for balance, both internally and muscularly, okay? So
I feel like I have to naturally do this.
Yeah, and that's going to tilt the spine, and then you get all kinds of problems. This is why you guys are out there watching, like, I always have lower back and neck pain. I hear it every single day. And so it's like, but the good thing, to be encouraging is that it's correctable, okay? So we'll look at Doc. So just relax, Doc, all the way. Okay, so Doc is low here, obviously. So that would let me know that it's possible that we need some strengthening in the upper trapezius, Doc, that looks like the position of the scapula to me is healthy here. He's not what a lot of overhand guys get, which is called, it's called winging. When you get out in here like this, okay, and I'm going to talk about that later when we talk about side posture and whatnot. But you get out here and you get winging like this, that lets you know you got all type of tension in the front, weakness in the lower trap, all this kind of stuff, okay? So we'll come back to normal. But I'd say for Doc, we're lower, so I'm going to probably need to test some muscle tension in the lat, because if the lat's tight, it's going to pull the scapula down. Obviously, we're fighting the skeletal issue here, and we may need some strengthening up here to kind of lift and possibly retract the scapula. So maybe a little middle to lower trapezius strengthening would be beneficial for Doc as well.
And when you train like that, do you train both sides or you train just one side?
Okay, so you want to make sure, Doc's question was, do you train both sides? Okay, you don't want to, what you want to do is correct what's wrong first, but you need to also see if there's anything over here that needs correction as well. Because typically, we're looking at a little overuse on the dominant side, and that means muscle tension chronically, which typically means you need to do more myofascial release, which is a fancy way of saying you need to massage yourself. Okay, or go see a masseuse, use a foam roller. We'll talk about that later in the show. But anyways, so there you go. So we'll go ahead now. Once this is kind of generally speaking what I'll look for on the back, and then we got to get Doc to turn to the side. So when you look at the side of the body, okay,
That's good.
yeah, you look good. Yeah. So when you look at the side of the body, the first thing that I look for is you want to look at the pelvic tilt. Okay, so all of us have a kind of a way that our pelvis sits. The majority of us are semi, I would call it, lordotic, which means the pelvic is going to be tilted anteriorly or forward. So you're going to see more of what our general population refers to as a swayed back. There's lots of different things that cause sway back. It could be weakness in the deep muscles of the lumbopelvic area that kind of actively work with the pelvis throughout your daily life. Unconsciously, it could be the second layer of muscles that need improving, and then maybe a little bit of superficial muscle as well. You never know till you assess the person further. From there, there's also the possibility of having more of a neutral pelvis, which is a great pelvis for athletes. And then there's a posterior, which is very rare, where the pelvic tilt is kind of too far this way. That's kind of a rare one there. Not a lot of people are like that. If they do, we usually got a lot of shoulder issues because they can't
work to do.
Yep, can't flex the shoulder very well, and neck issue as well. So from there, and then I like to work my way up and just let the hands rest by the side dock. And you begin to look at that thoracic cavity that I talked about earlier, which is the mid back. There are 12 vertebrae that comprise the thoracic cavity of the spine. And I want to get a look at the curvature of that. Doc has a great spine. Okay, his spine has
working on it.
Dude, natural, very nice curve in the lumbar. Thoracic is not overly what you would refer to as kyphotic. Now, if you're a person, our general population refers to as kind of being humpback, like this, okay. That kind of spine is very dangerous if you're an overhead throwing athlete, and you have to be very careful about that because the sports in general pushes you repetition after repetition into flexion, and your brain gravitates to what it does most. So it's going to kind of want to rest in flexion. You have to be very careful. I talk about that later in the interview. And then from there, I'll then look at the humeral head position. So we kind of worked our way up now, low back, mid back. Now we're at the shoulder. What you want to look for in the shoulder is how the humeral head, the upper part here, where the deltoids are, how does it rest? Okay, is it neutral like Doc's here? Doc's looks pretty good. I'd say you can tell that he has, maybe some people refer to it as a sloped shoulder. It's kind of, it's in the state of depression a little bit. It's kind of low. Is what I'm saying.
It's a sad shoulder.
So for Doc, that further validates what I was seeing earlier, and then we probably going to need some upper trapezius strengthening and some pectoralis minor lengthening. Okay, so there's also this one when you're in here like this, where you're roll forward. A lot of guys ages, I'd say about 11 to 15. When I get them in here and they're just starting to throw maybe a little bit harder, baseball's getting serious, all that kind of stuff, they look like this. Or you're a corporate gym exercise type guy and you love doing muscular development for the superficial muscle of your body, but you never stretch out. You're always banging out chest reps and whatnot. The pectoralis gets tight, you guys. The way the body works, it's going to pull the scapula around the rib cage and put you in a position like this. Big time no-no.
Well, sometimes too, the problem is you're a desk jockey. A desk jockey.
Oh, Lord, yeah.
Like this. all day working.
Yep, I was just going to get into that.
Sorry.
It's all good, Doc. You're all good, man. I mean, we're getting there. So the shoulder position is key. This has a huge impact on how the scapula moves. The impact that it has on the bursa sac, which is a fluid that's inside of the shoulder that kind of creates kind of like a cushioning thing in there for us. And then the tendons in there as well. When the shoulder is in this type of posture in particular, it will wear and tear down that bursa sac and tendon. In time, it could fray it, which means like kind of like tear it a little bit, right? And that's when you start getting impingement stuff, and that sucks. And it's terrible. Okay, so we want to be kind of like Doc here, nice neutral position. We all also have a genetic disposition, you guys. So if you're slightly here, or maybe you're kind of slightly into this retracted state, you don't got to freak out about it or nothing.
There's a normal range, right? That's all it comes down to.
Your body was created in a unique way. If this is your posture, you just want to evaluate. You want to have a professional evaluate to see if your life activity, sports activity, what you're doing is causing this, or if it is truly your natural genetic disposition. Okay? So in a nutshell, you guys, that's kind of a skeletal resting posture. That's why I like to refer to it as a musculoskeletal assessment of the body. Okay? Let's see. Let's talk. What I wanted to talk about next, Doc, if you have anything to say, is the typical occurrences that I deal with in my studio with people in relation to the shoulder. Okay? So first of all, let's talk about is elevated scapula. So let's turn around, Doc, and show them. Elevated scapula, okay, is when you are tight on top and weak on the bottom. One, okay. Lower trapezius, it's, we're attached in here. The lower portion of the scap, it kind of holds the scapula in here, aids in downward rotation, all this kind of stuff. Okay. When you're tight up in here and weak here, the shoulder's going to be elevated in here like this. What usually also is an occurrence is a tightening in the pectoralis minor. Okay, what that means is your chest is let's say it's divided into just two pieces for the sake of the conversation. Okay, you got a major and a minor. The minor is the top part. Okay, if the top part of the chest up in this area in here, it comes in and it connects in way deep in here, in your armpit. Okay, so when that's tight, it's going to tighten and it pulls the shoulder forward like this. So let's get from the side now. This is what I was talking about earlier. You're going to look like this and like this, and then from the front, you look like this. This is what you look like. Okay, this is extreme, but typically it looks like kind of like this, a little bit like that. Okay, go ahead. Go back on the side. So. That is typical. That's the majority of you guys out there, okay? You're tight on the top, you're weak on the bottom, and you're tight in the pectoralis minor. You have chronic tension that's holding the humeral head in this position, and it's moving the scapula outside. Turn around, Doc. It's moving the scapula out here on the ribs, which for shoulder function and quality of movement, not good. Okay, you don't want that, especially if you're an overhand throwing athlete. You definitely do not want that, okay? Now you may say, oh yeah, but Derek, so-and-so in the major leagues looks like this, he throws 100 miles an hour. Yeah, you know what, he throws 100 miles an hour, he's in the major leagues. He was gifted and born like that, not that those guys don't work extremely hard to get to that level, okay? But he has a genetic disposition, and I guarantee you that the athletic trainers and strength coaches in that organization are paying very close attention to that man's shoulder. And how it functions, his muscle tension throughout his body, his symmetry and strength. I bet my facility on that. Okay, so then from there, with this type of shoulder function that I'm giving an example to you guys of today, it could be possible as well that the skeleton is having an impact on this, creating these type of muscle recruitment patterns from the brain at rest. Which is kind of further validated in the skeletal assessment as well. Okay, so Doc, we can go ahead and relax. You want to put the shirt back on, Doc? So like Doc was saying, you guys, I want to give some reasons that the general population experiences these things. Typically, you guys, it's your daily posture. The brain is always going to gravitate, like I stated earlier, to what it does most. So if you're on our culture, I'm seeing it more now with the younger kids the last probably like 6-7 years. Because of the phones. Everybody gives their child a phone now when he's 7 years old, and then they're already in this position on their phone all day long. So when they're teenagers by now, and they're coming in here, their posture is it's very poor, in my professional opinion, on where it should be for a 13-year-old male or female, especially if you are an athlete, Doc, okay? Those are, and then like Doc said, your job. You know, it'd be straight up with you guys. In my job, I'm required to look down at people all day because a lot of exercise stuff is done on the floor with our body. So I'm somewhat bent over into this position, you know, evaluating, instructing, coaching, whatever, all day long. And so I have to be aware of my posture just like anybody else does in their line of work with that, okay? If you're a desk person, it is very important that you spend money on getting a quality desk chair and that you have an understanding of how to position your chair ergonomically so that the thoracic cavity of the spine is held in in neutral or extension. Well, how should I say that?
I tell people extension because they're neutral. The neutral's here.
Okay.
So you want to go wherever you feel comfortable. You want to go into extension so that upper thoracic that Eric's talking about, even the lower lumbar, are more into extension. So you feel the muscles activated. Not relaxed when they build up lactic acid. So when you get up from the chair, you're like, okay, now it hurts. So you want to focus your mind is how you stay in extension, so your body stays here. Then over time, as you train, at that point, this position 2 becomes your normal posture. And it's easier to maintain once you're here because you know when you're here, it doesn't feel good. That's the plan.
Yeah, right on. That's cool. So here, you know what's a good little cue for this is you get a chair. You go to I don't know, Stater Brothers or like a toy store, and they have those little balls like this that your children play with. Okay, and you know I tell clients to go spend $4 and buy a little ball. I got one in my office right now for my chair. It's got like Mighty Mouse on there or something like that, right? And I put it right here in just below the point of the scapula, so we're kind of in that mid-lower thoracic cavity. And when I'm at rest, it pushes you into this position, and your brain will get used to it, and it will hold that there. Your shoulders will drop. They won't be like this, or you won't be like this, you know. When your thoracic cavity moves into extension, the brain was created in a way to tell these muscles to loosen and to bring the scapula more into an ideal resting position. So you will be able to do this. Then you get into ergonomics of office space and how close your chair should be to your typewriter or your keyboard. And then the height of your desk. You know, if you are shorter in height, let's say, you may have to saw off the legs of your desk a little bit to bring that thing down if you want to alleviate some of this upper trapezius and neck pain that you're constantly coming in here and complaining to me about.
Or just buy a smaller chair, maybe.
Okay, you know what I mean? What I'm trying to get at is you're trying to get your body in a height in relation to your keyboard to where you get more in that relaxed, natural state, not in a tense upwards position of the scapula. Okay?
That's the plan.
Yeah, there you go, Doc, for that.
Good.
For the athlete, like I stated earlier, I didn't want to make it known. If you're an athlete and maybe you're dealing with shoulder pain, or it hurts when you do this, guys, flexion, and you're dealing with probably impingement, okay? It's usually because you're kyphotic and the shoulder's out of position, and when the shoulder rotates in here and the arm comes up, it ain't moving just right, and the bursa sacrum tendon is getting inflamed, and then you're like, I got shoulder pain, and then everything goes to crap after.
But it's almost there's a normal groove everything wants to sit in.
Absolutely.
And like your car line, the same thing too. If we do it for a day or so, not a big deal. But day 10, day 20, mile 50, at that point, that's when you see the rub. That's when you see things wearing itself out.
Everybody thinks the rotator cuff just rotates the bone, and it does do that, okay? Yeah. But those 4 muscles do a great, I would say like a fantastic job, is they stabilize the humeral head in there. Okay, that's like, yeah, they hold it in there so that when this, what I believe is the secondary function, when it turns the bone like this, okay, it does so efficiently. So if you're a pitcher, you better have that shoulder pretty good at stabilizing. I should say excellent at stabilizing.
It's not pitch 10, it's pitched 100.
Yeah.
Day 2, day 3 in a row.
Yeah, and you got to throw every day. It's hard being a pitcher. Hitters got it easier in my opinion. They can rep out all day. Maybe a little low back pain. Pitchers, you can only throw so much, man.
Not the bat boys. Bat boy okay?
All right, yeah. Okay. So what I'm sure most of you guys are thinking now is, okay, so what do I do? So here, I'm going to tell you. This is what you guys do, generally speaking, for this kind of upward, forward shoulder issue. Okay, so you want to grab the camera, Doc? We'll take it over here.
Let's go over here.
What's up, John?
Look what I found. A tiny tinky lock.
Saw Frankie yesterday. He said hi. Check out Mr. Derek's space. There it is.
All right, cool, man.
All right.
Come on over.
Cool.
Okay.
What do you got? Yep.
Right on there?
Yep.
Okay, guys. So look.
I'll go from this side so you can show the lighting. There we go.
Okay, so what we're going to do, guys, is the first thing we're going to do is you want to try to alleviate any type of chronic muscle tension that your body is carrying throughout the day, okay? And this primarily occurs in these muscles in here. They got a fancy name like sternocleidomastoid and
Scalenes. I call them scalenes right there.
Yeah, the scalene's a big one, okay? So what you got to do is you got to get in there and you got to rub them out. You can either become friends with a massage therapist, maybe you get them for free. You can go schedule a massage and spend $60 to $150, or you can learn how to do it yourself. In the long term, you guys, you want to learn how to do it yourself. There's a lot of other things you can do in the meantime. You use that KT tape. KT tape is fantastic for kind of a period of time when you're getting yourself better, or if you're an athlete and maybe you lack stability because of an injury, you need added stability. KT tape is great. But again, we're talking general population here. So we got our old friend here, the foam roller. This is the classical foam roller, man, just the good old long one right here. I also have another one in here, and a device called the orb, which is just it's just a sphere of foam that has just the perfect amount of density where it's not over the top in its pressure into the tissue, because they can become painful, So for the general population, I really would recommend the foam roller, and that you just learn how to use this thing and manipulate your body so that Okay, go ahead, Eden. So that your pressure into the muscle is not overly uncomfortable, but you do got to kind of get some work done in there. Okay?
Good.
So what I thought I'd do is just get down on the floor and just show you guys some simple ones. So remember earlier in the discussion, guys, I talked about the trapezius being divided into three pieces. An upper, a middle, and a lower. What you really want to focus on if you're having the kind of shoulder issue I've been talking about all day today is trying to get that upper and the middle one to release a little bit. Okay, so you want to just get down on me, Doc, here.
Got it.
So here we go. So what I would recommend for upper trapezius specificity is to get the foam roller in the same angle as the spine, like you can see here, okay? What I'm going to do is I'm going to lay my body on the foam roller. I'm going to pretend that my right upper trapezius is holding tension.
Do you want me to get more of an even angle?
Well, let's just see what it looks like when I get in position.
Got it.
So what you want to do, guys, is you want to take your spine. If it's the right side, you want to have the roller be on the right side of the spine. Okay. Then what you need to do is you need to elevate your hips by kind of squeezing your glute muscles together. Your rear end, and you feel your hamstring muscles kind of turn on and tense up as well. And what that's going to do is that's going to elevate your pelvic area and your spine, and it's going to put more body weight to work with gravity into the tissue and put that pressure into the tissue that a massage therapist would put into your body with their hands, per se. Okay?
Perfect.
Once you're in the position that I just explained, you're then going to want to move the roller in a lateral fashion like this. Now, all muscle fibers predominantly run in the east and west or north and south kind of direction. So what you really want to do is you want to work with the direction the muscle fiber kind of was created to function, I believe, first. Then you should kind of go in the opposite direction. And then what's also beneficial is what I call like cross-sectional. And that just means that you're going to kind of get into the muscle and kind of twist that guy a little bit, where you kind of get in there and you kind of move it around in all directions like that. Masseuses do that kind of stuff where they get in there, they'll kind of press and turn. Sometimes they'll use their elbow and they manipulate it a little bit. That is uncomfortable. Yeah. So that's something you want to do maybe after a couple weeks or something like that, where your tissue is more used to the stress and the pressure, and your pain tolerance will increase as well. Okay, cool. So let me give you guys a quick demonstration here. So again, you want to get the body on the roller here, and you want to feel the roller. So I can feel the roller be on this side of my spine, and what I'm going to do is I'm going to elevate my hips in this fashion. Maybe I'll turn around.
Yeah, go from the side. That'd be bueno.
Okay.
Yeah, either way, that's fine too.
Okay, is this okay here, Doc?
Yep.
Okay,
I'll
so
back up a little bit.
I'm gonna get up here and I'm gonna elevate in here like this, so tight glute area, and this is gonna bring the pressure right into that upper trap. Now, to get the upper trap, you gotta get your hips way up there, okay, or it's gonna stay around in the middle. So you gotta kind of go for it. It's uncomfortable, okay? And then you wanna take your shoulder, and I think you should kind of move it down a little bit to kind of create some space there.
Ouch.
And then you're gonna begin to roll on the tissue like this. The higher you go, the further up you get, usually that's where you got to get it, okay? In here like this. So you do that. Anywhere from 5 to maybe 40 rolls, depending on your injury.
Yeah.
and your tolerance level,
Yeah.
okay? Then we're going to get it like this. When you're going to go up and down now, okay? It's important that to get the side, you have to take your legs, you got to walk them this way so that I can get my acromion bone out of the way. And I put the acromion bone on the inner portion of the foam roller, like this, and then I elevate very high, and then I work this movement here, in here. And I use the muscles to move my shoulder around to create space, and you have to search for tension, find it. Sometimes you may just want to hold tension, get real high. Other times you want to kind of maybe roll over and search in here, like this, and you got to just find it, man, and get it out of there.
Can we try on this side too?
Yeah. You want me to do this one?
Yeah, do the perfect.
Same thing. Kind of move it, open it, get up in there, and roll that sucker out of there.
Good.
Okay.
So between the neck and the shoulders, we want to kind of roll that out then, correct?
Yeah.
Perfect.
Absolutely.
Go.
Yeah.
Great.
So I'd start there. The reason for that, you guys, is because you want to decrease the tension in the muscle so that naturally the bone begins to go back to where it was created to be at rest in there, okay? And then from there, you're going to have to start then using strengthening exercises to try to reposition the scapula into a more optimal resting posture. So typically, like I said, we are tight up top. You don't need to strengthen what's tight usually.
Yeah.
You need to loosen it, but we're usually weak on the bottom. So we're going to have to do some lower trapezius strengthening. I'm going to show 2 exercises. One that's a combination of lower trapezius and external rotation. I think it's probably if you're going to do one, man, I pick this one. Okay?
Great. Yep.
Yeah. And then I'll show you one that kind of isolates more the lower trapezius in there. Okay. So let's kind of move on to those.
Let's go.
I'm going to grab a band real quick, Doc. I'll just come back over here.
What's up, Mario?
Okay, so you want to raise it up so I can see my face?
It's a good idea.
Yeah, maybe a little lower.
Sure.
Okay, guys. So here we go. So lower trapezius. To strengthen the lower trapezius, what you need to do is position the humerus so that the lateral head of the deltoid is really not in turn on, okay? Because when you turn the lateral head on, it's going to elevate the humerus in this plane of movement here. But we want it to be down so we can get lower trapezius turn on and move the lower portion of my scapula back and down also into depression as well, okay? So here's a great trick. The shoulder, like we talked about, the rotator cuff does some functions. It internally rotates, it externally rotates, it stabilizes, all this stuff, right? So external rotation is usually where people lack strength, okay, and muscle memory. Again, because of our live posture and stuff like that, typically is like this, okay? A good exercise, you can find these bands anywhere, right? You probably buy a 3 to 5 or like a 4-pack of them. They come in, I don't know, they're like $11 or something like that. You can also use strength bands, cables, whatever. But this is the most affordable and commonly occurs in your guys' homes, so I'm going to use this as the example, okay? What you want to do is you want to hold the band in front of you like this with your elbows at your side in your natural postural state. Okay? From there, what you want to do is you're going to use the muscles in your back to retract the scapula. Now what's important is that you notice is, I'm going to stay facing you in the beginning so I can explain this so you can hear me better, is that when I do retraction, you notice how my shoulders, they don't really elevate much. A little bit. The brain naturally is going to turn on the upper trapezius at the end to begin the the possible rotational movement of the humerus, okay? But we're not going to rotate it. We're just going to retract it. Then what we want to do is, while retracted, turn to receive both a lower trapezius turn on as well as a rotator cuff stabilization turn on and external rotation turn on. You simply will retract the scapula. A good way to think about it in your guys' brain is that you are trying to pinch a pencil between your shoulder blades. Very easy explanation for most people to understand. So we pinch that pencil. Again, no elevation. We're in here. Now we don't have to be in extreme depression like this. We just want to be kind of more in a natural retraction. Then we're going to externally rotate the bone. And while the bone internally rotates, we don't lose that scapular retraction. You see how my shoulders stayed back? I'll show you one more. I'll show you from the side. Now, from the side, I'm going to go ahead. Here's my natural postural state. I'm going to retract, and then I'm going to externally rotate. Okay? And again. And then from the back, it looks like this. Natural posture is here for me. Go ahead and retract, and then external rotation. External rotation. Okay? There you go. Great exercise, man. If there's one you're going to do in your home, if you got a young baseball guy and he's not doing that, you should start doing that tomorrow. It'll help you guys out so much. If you're a person, you deal with daily shoulder pain, man, apply this stuff to your life. You guys can always contact me personally. You can reach me directly through my website. It's lpecoaching.com. Again, the name of my private studio is Life Performance Enhancement, fitness, sports performance, rehabilitation, expertise in human movement that involves rotation of the spine and the shoulder joint. Deal a lot with baseball players and golfers.
So what I'm going to do too is also put all the information on the website and also this video too. So it shows all the links to how to contact you along with the YouTube video afterwards too, which we'll link back to. People can watch it now, later, whenever they want to. Yeah. You can share with their friends and family. Hey.
For sure. You got anything you want to add, Doc?
My biggest thing is when you talk about the shoulder, like Derek went through, you have to worry about the whole body.
Yeah.
It's not just if you go to an orthopedist or sometimes if you go to your primary doctor, have shoulder pain, what's the first thing you do? What kind of meds do you want?
Oh,
Maybe even check the shoulder too. The problem is sometimes the problem may not be here. It might be other parts of the body kinetically improper or off balance to cause problems with that shoulder. So if you're an athlete or a non-athlete, what are you doing to make sure the whole body is functioning well? Even though this may be painful, other areas might be the next thing. If you check the whole body out, someone with Derek, that'll let you know exactly what problems that you may have that aren't symptomatic, that you don't have any pain yet with. That'll let you understand how can I fix the whole body efficiently versus going for this 1 month, and all of a sudden 2 months later, now you have a problem over here, or over here in the knee or something.
Yeah, it can happen.
That's my biggest thing with Derek. When I've done this, I think our fourth episode is we walk through how to. Now this is the step process, and this is kind of just breaking the ice, how to get your shoulder better. Next reel will be maybe about the hip, maybe about this stuff too, but can we walk through and give you an idea of what you have to worry about going to Derek, or if you're not in the area, somewhere else, and this is what you should expect from someone when they get the full assessment.
Yeah, I really believe that the assessment that I created, you guys, I believe is as thorough as you're going to find anywhere. It is so exhaustive. I literally spent a few years just putting this single assessment together. That's why I refer to it as a musculoskeletal assessment. The body is exhaustively examined to ensure that I am doing the absolute most I can with my education and years of experience to bring you guys into an optimal physical state. When your body's in a state of physicality that is near optimal or is optimal, in what I believe is optimal health physically, everything's going to be better. Your sleep's going to be better. Your brain functions better.
Yes, the nerves are better.
Yeah, your nerves better. Doc knows so much about the nervous system. It's like your body's going to be going to be firing on more cylinders, so to speak, than it would otherwise. So we all have different opinions on what comprises a human being. Obviously we are a human being of mind and of body, and where you're at in the spiritual sense, that's a free will decision. But mind and body is a reality that we all can agree upon, and so I believe you should take part of your time that is given to you and use it to improve yourself in those areas.
And one thing is too, Derek, what's the average or even the baseline baseball contract, say professional contract?
What's the average one?
Yeah, what's the average per se? If someone gets to the big leagues in baseball.
Oh, like the amount of years they spend there?
Well, actually, how much do they get paid?
Oh, Lord, I really can't answer that question.
Would you say at least $500,000?
I mean, the medium major league salary, I think now is approaching $600,000.
So saving $5,000. You're getting someone that helps an athlete get to that level, that allows them to make that kind of money to support them and their family. But I don't make that much money, but you may do that. But that would get in someone quality who has that type of quality that those athletes trust Derek with. Why not understand if he does that for them, meet that because I'm not a professional athlete. Can he help me too? At that point, bring his education, his experience to help you understand. Okay, I'm having a problem with this, but what's my big picture?
Yeah, I mean, like Doc says, I was a strength conditioning coach at the university scholarship level for 5 years. I mean, I coached in the College World Series for the #1 ranked team in the country 2 times, at Azusa Pacific University.
First time might have been luck. Second time, I don't think it's luck.
As both the pitching and the strength conditioning coach. So I've dealt with, hundreds of shoulders, you guys.
Yeah.
So it's just like, it's another day at the office at myself. But I'll never be arrogant enough to say that I never stop learning. Every human being that walks in here in their own way, they are completely their own person. And what's required of me in their body is unique. And that's why I offer personalized programs.
It all comes down to anything else, Derek, for I think our 4th show.
Yeah.
And I'm making things you'll get on YouTube, everywhere else too. Can you learn again how your body works, maintain that body, and then at that point learn how to get to the next level so you don't have injuries? And my biggest thing is how do we get people to become their best doctors, their best trainers, the best person? Working with Derek, he's going to educate you beyond what you even think you can know to make sure you understand your body to your best potential. All right, so
cool.
Thank you guys for watching. Appreciate that. It was hopefully you enjoyed the whole step-by-step process.
So from this talk, hope you understand that by assessing the whole body, we can not only help shoulder problems and shoulder pain and rehab of the shoulder, but also looking at other problems before they become a problem to make the overall body more efficient, less painful, less chance of injury. Again, we walk through exercises such as stretches with a band and foam roller. If anything, to go to the highlights to watch those videos, but also go to other videos too in the highlights. Understand we have other previous podcasts that will rehab your body, your shoulder, and overall body, and keep your body healthy. All right, so hope you guys talk again, my friends. Have a good week, and we'll see you next week.